Sigmund Freud was an Austrian neurologist and the founder of psychoanalysis, and was born in Freiburg in Moravia, but moved to Vienna with his family in 1857. He was an exceptionally gifted child and an excellent student. He attended medical school in Vienna and became involved in neuropsychology research and studied in Paris and Nancy with some of the most prominent psychologists of the time. After spending some time in Berlin, he returned to Vienna and set up a psychiatric practice. He adopted a new form of treatment with his patients that involved talking about their problems to trigger emotional release, known as repression, which is now widely seen as the basis for psychoanalysis. Freud's theories were well received, but he had many disagreements with other psychologists at the time, most notably the psychologist Carl Jung. In 1923, Freud developed a benign mouth tumor associated with his heavy smoking, which he had to have removed. After the outbreak of World War II, Freud went into exile in Hampstead, London, where he continued his work. In 1939, his mouth tumor returned, and he requested the help of his friend Max Schur to assist him in committing suicide. Schur gave Freud large doses of morphine, which ultimately led to Freud's death. Amongst other achievements, Freud contributed to research into cerebral palsy, psychoanalysis, and investigations into the conscious and unconscious minds of his patients. He also investigated dream interpretation, and was a strong advocate of repression techniques to revisit repressed memories that have been buried or repressed by the patient, as well as psychosexual therapies. Although a controversial figure, Freud's contributions to psychiatry and psychoanalysis have altered the direction and focus of many psychiatric methods and techniques.